Hi, I'm Dr. Terry Lawwell. We're here at our main office in Danville. What we're going to talk about today is decompression therapy. What patients it's suited for, how does it help, and is it right for you? Stay tuned for more information, and if you like our page and follow, more information will be coming your way. Nikki here's having some low back pain. She came in having some pain going down her leg. That's sometimes indicative of a nerve being pinched from your lower back. What happens is your disc kind of squishes down, pinches the nerve, and there's no way to release it. Well, we have a decompression table here at Danville Area Chiropractic Center. What this table does is it relaxes the nerve by decompressing the back. How we do that is we'll show you here. We're going to strap Nikki in. We're going to gently pull her back to the weight of her body, and then it will slowly release the nerve. Now, this doesn't happen in 1 or 2 visits. This sometimes takes a few visits, but it's safe, it's effective, and most of the time when you're on this, it's pain-free. If you do have any pain, Nikki here or myself or any of our other staff members will come in and assist you, but we want this to be as pleasant as possible. So now that we have Nikki laying face down, she's comfortable laying face down. Most patients that we have come in, they do lay face down because you get a better pull while you're laying face down. And as we hook her up, we'll kind of explain why. So first thing we're going to do, Nikki, you comfortable laying there?
Yep.
So she's comfortable, we're comfortable, everybody's feeling good. So what we're going to do is gently strap her in here. Again, not very tight, but just enough to keep her there. And at any point, if she has any pain, she'll let us know. Same that you should do too if you have any pain as we're going through this. This machine is great. We can put you different positions based on your pain level. So we can have you lay face down, face up. We can even put you on your side on this machine. So Nikki's all strapped in here, but that's obviously not going to do anything. So what we have to do is hook her into the control head. As we hook Nikki up here, this will be the strap that pulls her. Okay. And this table's going to raise all the way up. So Nikki's done. She's not going to be doing anything for about 15 minutes here. So the table's going to come up. We're going to level her off, and then I'll show you why we like people to lay face down here. So we're going to put Nikki on 64 pounds of pull with 20 pounds of release. So that means this whole time, the most that she's ever going to be pulled is 64 pounds. That's why this machine is very, very important. It's similar to an inversion table. However, an inversion table has no pound control. Once you flip upside down on that table, it's getting pulled by gravity plus percentage of your body weight. This table here, we're actually pulling her at exactly 64 pounds, and that's going to release her to exactly 20 pounds. So it's very consistent. That's the biggest thing about this machine is consistency. We can control everything on here. So the last thing that we do for all our patients, including Nikki here, is we're going to give her a little button. Reach out to your left for you there, Nikki. This button is your safety switch control. So if at any time if Nikki's not feeling great, if something's pinching, again, very highly unlikely, but we always give the patient that tool. And if you push that button, it shuts the machine off immediately. It makes a loud bunch of beepy noises, and then one of the staff members or myself will come in and assist you. Okay? Nikki, feeling okay?
Yep.
All right, so we're going to get her started. Everything has already been set. This machine is pretty quiet. We also can use this machine for cervical decompression as well. And again, we have you on your back for that one. We turn this big bright light off so you're not getting blinded as you're sitting here for about 10 to 12 minutes. Nikki, how are we doing? Still doing okay?
Yep.
All righty. So the machine has stopped pulling. If you want to come over here and take a look. So that machine is now pulling her at exactly 64 pounds, counting down from 45 seconds, and then it's going to release her to the 20 pounds for 25 seconds. That's going to go through a cycle of the next 10 minutes. So again, consistency is key with these things. We're able to take all the guesswork out of it. This machine is very consistent, very precise, and we can start you there every time you come in. All right, so what happens here after Nikki was done, we're going to show you a little diagram of what exactly happens to your back or your neck. This is a lumbar spine. So the same thing happens in your neck though. So when you have a disc herniation, kind of comes out just like that. So see how that could impact that nerve coming through. Now these nerves from your lower back run down your leg. So if anyone's ever told you that you have sciatica, or if you have numbness tingling in your foot, or burning pain down your leg, sometimes it could be caused by herniation or a pinched nerve in the lower back. Not all the time. That's why we have you come in. We do an evaluation before we put you on this, because yes, we are still doctors, and yes, we want the best treatment for you. So what we're doing here on this machine is allowing that nerve to be decompressed. So look at all that nice space in here that you have now because I'm pulling up on that. So normally what would happen is your back would be squished down here. See how that nerve's getting caught in there? Again, this can come from degeneration, old injuries, your old football star injuries back from your high school days, or you weekend warriors that like to still go out at 60 years old and play football with the 20-year-old kids. So what happens is that gets stuck like that. So what this machine is doing is gently pulling and relaxing, and eventually what we want is this. Nice full disc full of good fluid in there, nerve nice and relaxed, and no more pain down your leg. Yeah. So what I'm going to get done now is the cervical decompression. So this strap here just helps keep your head back, and we don't want you running away when you're on this. So the same thing, if you have numbness tingling down your arms, if you have pain in your mid-back, cervical pain, headaches, this can help relieve some of that too. Again, we do an evaluation with every patient before we stick you on here. Now I'm going to get pulled at 22 pounds on here, and then relaxed to 10 pounds for a total of 10 minutes on this guy. So the reason I do it is for maintenance, just because I look down a lot throughout my day. If you have a desk job, you know how that feels, and it just helps me feel better overall. I'll get some more range of motion in my neck, less headaches, and overall just feel better. In our Shamokin Dam office, we will soon be getting one of these tables in the next few months. So patients in the area, you don't have to travel up here to Danville. It'll be coming closer to you. Thank you.